Hello, my name is Christopher Britton, and today I'm going to be talking about concussion. So, a concussion is a type of traumatic brain injury, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth. Any sudden movement can cause the brain to bounce around or twist in the skull, creating a chemical change in the brain and possible damage to the brain cells. As many as 3.8 million concussions occur each year, and almost half of those concussions go undetected or untreated. With such an alarmingly high number of concussions left untreated, it is important for not just athletes, but everyone who understands the seriousness of concussions and what to look for. Although the number of head injuries is common, it's important to handle the situation promptly with the help of healthcare experts trained in managing concussions. Any level of concussions can be severe health issues, with each case being unique, which is why it's crucial for the right treatment to prevent any long-term effects from delaying the treatment or improper care. With data collected from the University of Pittsburgh Medical Center, concussions in student athletes are common, and it's vital that they have an assessment from someone with concussion expertise. The same goes for concussions by people during their activities of daily living. With the prevalence of concussions, it's noticeable that 5 out of 10 concussions are untreated, with 2 out of 10 being from contact sports. So some of the implications occurred by concussions, these are the types of circumstances that will occur due to a traumatic head injury. So the exercise response and conditions. Exercise intolerance after concussion is believed to be the result of autonomic nervous system dysfunction. There is also low levels of exercise intensity, which raises arterial carbon dioxide, or PaCO2. Elevated PaCO2 also increases the cerebral blood flow, or CBF, out of proportion to exercise intensity, which is associated with symptoms that limit exercise performance. So it's good to assume that elevated PaCO2 could signal an incomplete concussion-related recovery. With that knowledge, it's important to not do too much strenuous activity during the initial stages of recovery, so there's no possibility of regression. With consultations with a specialized care provider, gradual return to daily activities and exercise can be beneficial in most phases of recovery to return to a field of play, better of your daily living. Most concussions improve within a month can be effectively treated with progressive, moderate aerobic activity with cerebral blood flow improvement. During these movements, it's crucial to monitor for any headaches or dizziness from exercise intolerance from the imbalances due to the uniqueness of each concussion injury. Moving on to types and symptoms. This mild symptoms of concussion is considered its mildest form. It is characterized by symptoms that typically last for less than 15 minutes and do not involve any loss of consciousness. However, individuals may experience various symptoms such as headaches, dizziness, nausea, light and noise sensitivity. A moderate concussion is characterized by symptoms that persist for longer than 15 minutes. There is still no loss of consciousness, but the duration of the symptoms combined with their intensity distinguishes a moderate concussion from a mild one. Individuals experiencing a moderate concussion may exhibit symptoms such as persistent headaches, sleeping difficulties, and coordination imbalances. Most severe form of concussion is grade 3, which involves a loss of consciousness. In grade 3 consciousness, the person may experience brief loss of consciousness either immediately after the injury or shortly afterward. Loss of consciousness can range from a few seconds to several minutes. Other symptoms associated with severe concussions may include severe headaches, confusion or disorientation, slurred speech, seizures, persistent drowsiness, or unequal pupil size. So some pharmaceutical indications, there are no medications that treat concussions or post-concussion syndrome. Medicines may treat symptoms such as headaches or nausea. However, in the first couple hours of after the injury, bleeding in the brain is a serious risk. So it's important to have so it's important to not do any non-steroidal anti-inflammatory drugs such as aspirin or ibuprofen. That should all be avoided. The safest pain medication in the hours or days after a concussion is acetaminophen. In general, though, health professionals tend to avoid medications during this recovery period. Concussion deranges brain function, so it's generally believed that avoiding medication helps the healing process following a head injury. Doctors are in agreement, however, that acetaminophen and drugs to treat dizziness and nausea are useful and do not interfere with any of the healing process. So some concussion data that I wanted to have for the protocol. In this section, I wanted to review said protocols associated with returning to activities from a concussion in relation to the Center of Disease Control and Prevention's information. So first, they label rest. You should take it easy for the first few days after the injury when symptoms are the most severe. Early on, limit physical and thinking, remembering activities to avoid symptoms to getting worse. Avoid activities that put you at risk for another injury to the head or brain. And you want to get a good night's sleep and take naps during the day as needed. Then we're going to move on to light activity. As you start to feel better, gradually return to regular non-strenuous activities. Find relaxing activities at home. Avoid activities that put yourself at risk for another head injury to the brain. Return to school or work gradually. If symptoms do not worsen during an activity, then that activity is okay for yourself. However, if the symptoms worsen, cut back on that activity until it is tolerated. Get maximum nighttime sleep. That means avoiding screen time and loud music before bed, making sure you sleep in a dark room, and keep to a fixed bedtime and wake up schedule. Reduce daytime naps or return to a regular daytime nap schedule as appropriate for the client or subject's age. Then we are going to go to moderate activity, which is when the symptoms are mild or nearly gone. You can return to most regular activities. And then number 4, for return to regular activities. Recovery from a concussion is when you can do all your regular activities without experiencing any symptoms. So this leads to my case study. I wanted to do an athlete who had, I wanted to do an athlete who had a head injury due to contact sports, since that is the most prevalent during concussions. So I chose to do an 18-year-old high school student who suffered a mild concussion from a football injury. He has experiences of nausea, light and noise sensitivity with headaches and concentration difficulty. If I was able to sit with this client and discuss with him in regards to normal protocol to a case study, we would detect that prior to his injury, he had weak neck muscles, which could have been one of the factors that led him to having more of a concussion injury. Some of the goals for when he wants to return to the field is improving his abilities to make sure these future head injuries don't occur. And when thinking about exercise tests, I wanted to do the Buffalo concussion protocol test and any baseline concussion screening test that would look at the brain processing and thinking function. So a little bit about the Buffalo Buffalo treadmill test. It's to assess the degree of exercise tolerance in patients with concussions, to identify the heart rate at which concussion-specific symptoms exacerbation occurs, and to help establish a safe level of exercise for treatment of concussion. This test will challenge the client through the increased elevation at a persistent rate to acquire information on their intensity output. Exercise prescription, I want them to start at 50% of their maximum heart rate and notice for any symptoms previously discussed that would limit their exercising. That would be any nausea, headaches, anything that would classify as a symptom from a concussion. And over time, I want them to progress to regular activities with guidance from their specialized professionals. So patients who would increase their workload over time, they would be advised to exercise for at least 20 minutes a day at 80% to 90% of their maximum heart rate, achieved until system exacerbation occurs. Patients who typically return every 1 to 2 weeks to reassess their exercise tolerance for a new exercise prescription would be more beneficial in increasing that time to going back to the playing field. Any considerations? I wanted to notice how the patient really feels about through the light exercise, progression over to moderate exercise, and response to their body from any movement, because since each concussion case is different, I want to see how this individual would handle the progression of more strenuous activity and how that would be on his head and how his body would react. When he's fully back, or when he's getting to that stage of being back to playing in contact sports, I would want him to prioritize his strengthening in his neck muscles with different types of variation of movements to strengthen those muscles in awkward phases of any fast turns or jolts or jerks or movements like that, to increase his muscle resistance to those types of exercises that could happen in real time during a sport, to limit any head injury. So in conclusion, the seriousness of traumatic brain injuries and concussions are nothing to fool with. Although mostly from sport-related activities, the treatment is the same for head injuries for someone's situation as a whole. This can be non-athletics as well. It's also important to note the relevance of concussions that go unnoticed and untreated, which makes it critical to seek information and professional help if there's ever an instance where you believe that you've suffered an injury to the head. Here are my references. Thank you.